Hey everyone, Dr. Nicole here. We are back with another Q&A for our six-part series. So for those of you who have not necessarily tuned into our six-part series, the video that we're actually doing a Q&A on today is in relation to heavy metal toxicity. And we have quite a few questions that were already submitted, but definitely feel free to submit more questions in the comment area. I'm happy to answer them on the spot. And then also for those of you who have not watched the video, we will be posting the video in the comments. So definitely check that out. If you haven't watched it, still feel free to tune in because I'm going to be kind of doing an overview of the video, but also in addition going through some really essential questions that people had in reference to it. So for those of you that are tuning in and maybe are not familiar with even the term heavy metal, the primary thing that we are discussing is different types of toxins and chemicals that unfortunately we get exposed to on a day-to-day basis. And we usually get exposed to quite a bit throughout our lifetime. And some of the things that are included in that are things like mercury, aluminum, cadmium, barium, lead, some different compounds that you may have actually never even heard of. I know many people have heard aluminum, especially in reference to aluminum cans, aluminum foil. We've heard of mercury, especially if we have been pregnant at some point. We are usually advised to avoid fish because of the mercury content. And and then lead. We've heard of lead paint in old homes, but I feel like those are primarily the ones that get the most press. But unfortunately, there are an array of different types of heavy metals that we get exposed to quite often. And the video goes a lot more in depth about these heavy metals and how they're actually affecting our health. But one of our main questions that was asked was, what is the best test for diagnosing heavy metals? And I think this is a really good place to start, primarily because there are many patients that walk through our doors that said, I've been cleared of heavy metal toxicity. And this is usually following some questions about, do you have silver fillings in your teeth, or do you eat a lot of fish? And sometimes when the answer is yes, we have a brief conversation about the possibility of heavy metals, and then they'll usually say, well, I did get tested in my blood and everything was fine. So one of the most standard tests is definitely using blood testing, but unfortunately, you're not always going to find heavy metals in the blood. And the reason being is because if you had massive amounts of heavy metals like mercury or lead or arsenic that were in your blood, you would be very, very, very ill. So your filters, like your kidneys and your liver, are always going to do the best job to get this stuff out of your system, number one. But also in the event that your filters can't keep up, or maybe your filters are not working the best because of your genetics, then your body is going to start storing these toxins to try to get them out of the blood as a survival mechanism. They definitely can get stored in the tissues that surround organs, but they can also get stored in fat tissue. So a lot of times when we have that stubborn fat tissue that's not going away, it's not because we need to cut our calories. It might be because we actually need to detox because the fat tissue is holding on to tons of chemicals. So, and when I say chemicals too, we're talking about heavy metals today, but don't get me wrong, you can be exposed to a variety of other things that are in plastics, pesticides, herbicides. These are things that we are exposed to on a daily basis. So blood being the standard of testing, but not necessarily being the best avenue of testing, there are a couple of different options when it comes to heavy metal testing. So one of the other avenues to go is actually hair testing. The hair testing is something that we were using regularly in the practice. We did actually move away from the hair testing, and that was only because it would confuse patients because it's only an excretory test. For those of you that don't know what that means, it's only going to show us the heavy metals that your body is pushing out. So they're being excreted through the hair. So if you've had, say, a lead exposure because you lived in an old house with lead paint, and maybe you lived there when you were 3 years old, you could have been exposed to lead, but now maybe you're 40 and that lead has been in your system so long that it's now burrowed and your body is no longer excreting it. So this can actually show up on your hair analysis that you have a 0 issue with lead, and it's not always accurate in that sense. So this is something that makes sense to me as the physician, but it's not always the easiest to explain to patients. So the issue with hair testing is that it can also be altered by hair dye. So if you are someone who dyes your hair, which is many of us, then it's very hard to always get 100% accurate reading from the hair analysis. So another avenue of testing to go is going to be a urine analysis, a urine challenge specifically. So what you primarily do is you take a urine sample, and then you take it on day 1. You then give a patient a variety of supplements called chelators, which start to pull the heavy metals out of tissue, and then you take another urine sample to kind of compare the before and after. And this is something that is actually very effective, but at the same time, you have to make sure that your patient has very healthy kidneys. Because if you don't, then you can actually really, really stress the kidneys. And we don't always want to do that before we really know the whole picture for the patient. So what we've primarily opted for at this point is actually using a very specific technology called an oligoscan. And the oligoscan uses light and uses different aspects of light that can actually measure the amount of heavy metals in the tissue, but in addition, it can actually measure all of the minerals in the tissues. And just as a side note, I think this is really important to understand, because when we get blood work done and we're looking to see if we have deficiencies or if we are, absorbing our nutrients, we're looking at our B vitamins, we might be looking at vitamin D, we might be looking at calcium, magnesium, and other types of minerals. And, we are really basing, are we deficient or are we not, based off of what comes up in the blood. But at the end of the day, we really want to know what is being absorbed into our cells. And you're not always going to get all of that information from your, I'm blacking out as I'm talking. You're not always going to get all of that information from that specific type of test. So it's definitely really, really, really important that you can know what is going into your actual cells, and that is why we opted to use the oligoscan, because that is actually going to give us more of an intracellular measure and make sure that your body is actually utilizing the minerals that you're not only getting from your food, but you also might be getting from supplements. So that is a very important aspect. Don't always rely on what the blood work is telling you, because there are other avenues that are actually more accurate in that sense. So those are really the top ways of diagnosing heavy metal exposure. The other big question is, how are we getting exposed? And honestly, I could be here for hours to list how many ways we're getting exposed to heavy metals, but just some of the things that you want to take into consideration, because they are incorporated in daily living, is the use and consumption of beverages through plastics. That is going to be one aspect that gives us exposure to not really just heavy metals, but chemicals in general. A lot of our high fructose corn syrup that is in a lot of our sweetened beverages and even sweetened foods as well actually has traces of aluminum in it. And then we also have the things that are in our kitchen. I know that when I started educating myself a while back on, different types of pots and pans, and started realizing that a lot of our nonstick cookware contained traces of aluminum and even lead, I started to kind of move away from a lot of the nonstick and started to switch over to stainless steel and even cast iron. And I actually never really thought about my bake pans. I'm not a huge baker, but cupcake trays, bake pans, I roast a lot of vegetables on those bake pans as well. And when I had to pick up an extra cupcake tray for some event that I was putting on, and I was going through all of the different options when I was at the store, and I was like, oh my gosh, every single one of these is aluminum. And it made me realize that even though I got rid of a lot of my pots and pans, a lot of these other things that I was using in the oven were actually continuing to give the exposure to some of these heavy metals, aluminum being the primary. So with that being said, there are things that we are using on a daily basis in our kitchens that are actually giving us this exposure. And one of the things that we don't even really think much about is aluminum foil. And I do tell patients, use the aluminum foil if you are kind of like covering food, but you really don't want to wrap your food in the aluminum foil, especially say like baked potatoes. I know it's a tough thing because, you know, how else are you going to bake a potato? But you might opt to roasting your potatoes instead, instead of doing the baked potato. So these are just simple things to take into consideration that can cut down your exposure to the heavy metals that you might be exposed to on a daily basis. Brian Kelly, heavy metals in cupcakes. Nobody likes that. And actually, now that you say that, it makes me think about also the tins that we use in cupcake trays. So there are a lot of options nowadays that you can use. So if you're like, I don't really want to throw all of my cookware out, that's okay. Use parchment paper, and then also use those non-aluminum based liners for your cupcakes as well. So these things do exist. You can find them at health food stores. So don't go crazy and start throwing everything out per se. You can definitely find some solutions to protect your food from getting the exposure from this cookware. And those for you that are joining in, please feel free to ask any questions at any point. I'm just going through questions that have already been submitted. So another big factor that comes in when you're dealing with heavy metals is actually going to be your mouth. And I had the pleasure of hearing a wonderful holistic dentist speak. And for those of you that don't know what a holistic dentist is, this is a dentist that's thoroughly trained in how to remove fillings out of the teeth safely, especially the silver fillings, which technically have traces of mercury in them. And then we also, the holistic dentists are also equipped to use different compounds in the mouth that are non-toxic because unfortunately most of the things that they're using are containing these heavy metals. So even the fillings that are white, we're now gravitating towards these white fillings because they're supposed to be the safer option, but unfortunately they're containing cadmium. So this is something that is equally as toxic as mercury, and people don't realize this. Cadmium is something that's making its way into our food supply. It's making its way into our mouths by the safer alternative opposed to these silver fillings. So this is really, really important to have a conversation with your dentist or to potentially shift over to more of a holistic dentist. I would say luckily in New Jersey, we do have quite a few, and there are some in Pennsylvania that are only about an hour away. But if you are looking, you might find a holistic dentist. The other term to look for is a biological dentist. And these are going to be dentists that are going to be equipped on knowing how to protect you, not put toxic things in your mouth, but also potentially help you to remove the things that have already been put into the mouth. And when I had the pleasure of hearing this dentist speak, he actually, it kind of blew my mind because he not only talked about the cadmium in the white fillings, he talked about, you know, the mercury in the silver fillings, which I always equated the silver fillings to just mercury, but it's actually, they also contain silver and copper as well. So this is all extremely important to know, because if you do have a heavy metal test and you're coming up for some of these compounds and you're trying to detox, you might have an issue in your mouth that is going to continue to cause this toxicity despite your efforts. So we always make sure that we are actually looking and doing just a very simple dental evaluation with our patients, because we don't want to try to put them on this really extended detox protocol, but at the end of the day, their mouth is causing the problem. So this is definitely a huge thing to consider. I have a comment here. A holistic dentist told me once that mercury was the reason that suicide is so common with dentists. You know, that's so interesting that you say that, because the dentist that I had the pleasure of speaking with, his name's Dr. Lou Travato, and he discussed his very, very long history of trying to go through mercury detoxification. And he said that it took years because of all of the mercury that he was exposed to. And it's very interesting because he has a very fantastic practice out in Pennsylvania, and he has a lot of different students that come to him because they want to learn about the way he's practicing. And he said, he's like, I usually try to convince them to get out of the field because they're pretty much just going to be constantly exposed to all of these toxins. And it's really just a matter of constantly detoxing when you're in that profession. And, it was definitely very interesting when he said that, because you think about the mercury fillings, and a lot of dentists are trying to get away from that, but almost everything that they put their hands on is toxic to some capacity. So this is, again, just a really important thing to consideration. We've had actually patients that have come to us and they have described onset of symptoms. We actually had a patient who had an onset of mild Parkinson's, and when we actually dug deep into his history, it turned out that his fillings were removed by a non-biological dentist. It was just a traditional dentist that didn't use the right precautions, and he slowly started to have neurological symptoms, and that led to the diagnosis of Parkinson's. So this is something that it happens, and usually people develop these neurological issues that there's not always a known cause, because people are not connecting the dots, essentially. So the other big one with food, and I hope I don't ruin anyone's day, I know that I was devastated when I did my own testing and realized I was super toxic with mercury, because I had a long history of being a pescatarian, which meant I really only ate fish. At the time, unfortunately, I didn't know better. I didn't know about wild versus farmed. I didn't know that all sushi was not created equal. So I thought everything was free game. And with that being said, I consumed massive amounts of tuna, massive amounts of swordfish. Those were actually two of my primary favorite fish to consume. I definitely, when I was in college, I was on the canned tuna kick. I thought I was healthy because, it was low calorie, low in fat. And unfortunately, I didn't realize that I was getting massive amounts of mercury exposure. And in addition, I was getting aluminum exposure because of the canned tuna as well. So these are some things to really take into consideration. But the larger the fish, the more problematic it is with toxicity, not just mercury, other toxins as well. But, mercury is one of the big ones. So the top ones I tell my patients to avoid is going to be tuna, swordfish, shark. Shark is not the most commonly consumed, but definitely something to consider. I know salmon is a very healthy fish, but it is also a large fish. So if you are a huge salmon consumer, I would definitely say just try to mix it up with, some different some other options, mahi-mahi, grouper, some other types of white fish. It definitely is good to always have variety in the diet. I have another comment here. Can IWG determine if our fillings contain toxic metals? Can this be correlated with anxiety and depression? Yes, indeed. So one of the things that we do in the office is called autonomic response testing. It is actually a type of muscle testing that we use. And we actually check every tooth in the mouth to see if their fillings are causing a problem, or if there is issues with root canals. Or even infections. There's a lot of people that have infections in their mouth that they don't know, because they might not be brushing hard enough, and it's not like their gums are always bleeding, but bacteria can 100% be a problem due to teeth that were extracted, if that was wisdom teeth or if that was teeth that were removed for braces. But then in addition, many of our patients that come in and I ask them about their fillings, they're like, oh, well, that can't have anything to do with anything, because I've had those forever. I've had them since I was young. And usually what I say back to them is, well, the longer they've been there, the more likely that they have actually detached from your tooth or potentially even cracked. So with that being said, this can start to leach more and more and start to cause a lot of brain fog, a lot of anxiety, depression, and other neurological symptoms. The other thing too is a call on your cell phone that goes beyond 7 minutes on the ear specifically will actually start to mobilize the mercury out of your fillings. So if you're that person that walks around with that Bluetooth device in your ear all day long and you have fillings in your teeth, you are creating a huge problem for yourself. So this is really something to take into consideration, is a lot of the technology that we use on a day-to-day, which is such a blessing, but also dangerous at the same time, is it actually can mobilize and accentuate some of these toxins that are in the body. So if you are someone who has lots of fillings in the teeth, please speak to or use your phone on speakerphone, do not put your cell phone up to your head, and please do not use Bluetooth devices. It's very, very important. So one of the other big questions was in reference to, what do we do? What do we do if we have heavy metals, if we suspect we have heavy metals? And this, I think, is something that is really, really important to understand, because many of us start researching and we start to find a lot of information, and we find out about avenues of something called chelation. We hear about different types of chelating supplements, or maybe we go the route of IV chelation, which is usually going to be done under, obviously, the supervision of a physician. Or there might even be other types of supplements that we read about to help to get this stuff out of our body. So the biggest thing that you need to know about this process is you absolutely need to make sure that you are supporting the detoxification from start to finish. And what I mean by that is your liver needs to be supported, your gut needs to be supported, your gallbladder needs to be supported. So if you are someone who is a constipated person and you're like, oh my gosh, I just watched this video, I have all these fillings in my teeth, I need to go get them out. You need to get your gut working before you start taking toxins out of the body, getting your fillings removed, taking supplements for it, because you need to make sure that all of this stuff is going to eliminate out of your system. So the biggest thing that we always advise, if you are going to work with us or if you are going to go the avenue of getting your fillings removed, is make sure that your lymph is working, all the lymph nodes of the body. Make sure that is working, number one, and make sure your liver and your gut are working. Because if those avenues of filtration are not working, you are not going to be able to get this stuff out of your system and get it out of your tissues. So you need to make sure that this is being supported. And some of you may have gone down this road and you've tried to, either change the fillings out, or you did try some type of detoxification on your own and you got really, really sick. And then you read, well, sometimes this is normal, it's okay. You're going through a detox. You can feel crappy as you do it. You really need to know that it's not you're going to feel great detoxing, but you really shouldn't feel terrible, and you shouldn't have major brain fog and memory issues going through the process, because what that means is you are detoxing and then retoxing. So if your liver and gut are not working optimally, there is actually a system in the body that will cause the liver to dump the metals into the gut. And if the gut cannot flush them out through the bowels, then they are going to then recirculate back to the liver. But unfortunately, if you have damage to your gut lining, what we call leaky gut, it is going to get into your bloodstream and make you very ill. So please, please, please make sure that you are being careful going through this process. You're working with somebody who knows what they're doing, because there is a science to it. And, if you do have lymph issues, you can go the route of using things like infrared sauna. You can use dry brushing. But if more of your problem is going to be liver gut related, you want to be using maybe colonics. You might be wanting using enemas. You might be using very strategic supplements. So it's not about just going in and trying to get rid of these heavy metals. It's supporting the system start to finish. So I hope that is helpful. Another big question was, as a new mother, can I pass heavy metals along to my baby through breast milk? So unfortunately, I am the oldest, but the oldest and the firstborn gets 80% of mom's heavy metals. So I did go more in depth about this in the video. So with that being said, a lot of our heavy metals, mercury included, is passed down generation to generation. So if you have an infant who is maybe colic, or you have a young child who is having sensory issues, they're having developmental issues, they're having neurological issues, you might want to consider that they have potentially been exposed to metals, not during their life, but because there were metals passed. And that could be because mom had a lot of fillings in the teeth. It could be for a variety of different reasons, but it is really important to take into consideration, because I know a lot of children are going through a lot of therapies, cognitive therapies, behavioral therapies, sensory therapies, and that is needed, but there also might be another layer to it that could speed up the process. And there are very, very gentle ways that you can help to mobilize toxins in a very safe way with first a mother who is breastfeeding, and secondarily even a small child. And one of the key things that I use is chlorella. Not all chlorella is the same. I definitely suggest you have to get it from a very good source. BioPure is one of the absolute best for chlorella, and they have 5 or 6 different types. They all do different things. They all are different different strengths as well. But chlorella, just so you know, is a very, very safe thing for mothers to use while they're breastfeeding in order to prevent the passing of any toxins to their child. So that is definitely something that can be utilized. So another question that we have here is kind of going back into some of the household items and, you know, what are some of the different alternatives that are out there. So I mentioned before that you can be using things like stainless steel, using ceramic, using cast iron. The biggest thing that I would say is cast iron got really popular recently, and there's a lot of companies making it, and some of them have enamels on them that are being geared or advertised as, you know, non-stick. So just be cautious with that, because some of these enamels are not as safe as they're making it out to be. You know, trying to really go with the traditional cast iron, and even Le Creuset is a great option there. But those are definitely some really safe alternatives for your cookware. And when it comes to your bake pans, utilizing just parchment paper and different liners that are non-toxic is another very important thing. So I think that is actually most of the questions that I have here. We did talk about sushi, and as an individual looking to start a family, how important is to detox the body before trying. You know, the one thing I'll say is not everybody needs to detox, but if you are someone who's maybe been struggling with infertility, you know, definitely get checked. Get checked to see if heavy metals is part of the puzzle for you. Because if you do have a good amount of toxicity in the body, your body knows best, and it doesn't want to pass that to your child. So it's something just to take into consideration, especially if you've been down the road of going through fertility treatment and it hasn't been successful. You know, you really want to make sure to get checked if there is a toxicity component or even a deficiency component. And that's something that I talk about in the video, is that heavy metal toxicity has a tendency to take the place of your mineral receptors. So you will be quite mineral deficient, and one of the biggest manifestations that we see with that is going to be restless leg syndrome, leg cramps, muscle twitches, eye twitches, just feeling overly sore, not feeling hydrated. These are all things that can definitely indicate that you're quite mineral deficient. And even a poor immune system. Zinc is one of the primary minerals that gets wiped out with heavy metal toxicity, and zinc is the absolute driving force behind your immune system. Your immune system without zinc is like an army without bullets. So it's very, very important to make sure that zinc is sufficient in the body, but you can't always be successful with replenishing when heavy metals are part of the puzzle. So I hope this was really, really helpful. Definitely feel free to post any additional comments, and we will hopefully reply within about 24 to 48 hours. But if you have not watched the video on heavy metal toxicity, please check it out. The link is in the comments, and I appreciate you guys jumping on with me and asking some questions, and I will see you next week for our next part of our video series. All right, have a good night, everyone.